Partnerships to mitigate ACEs. My name is Olivia Heinsroth, and I'm a program manager here at the Illinois chapter of the American Academy of Pediatrics. Thank you so much for being here today. Today, we are joined by our moderator, Dr. Kristen Keenan, as well as our four panelists, Annie Burns, uh, Eva Weil, Gloria Barrera, and Dr. Preethi Ragapatruni. Our session is being recorded currently, and the recording and slides will be shared after today's session. Please use them as well as the Q&A feature here to submit questions you may have during the presentation, and we will answer them at the end of our webinar as time allows. Here is our CME accreditation statement. When the webinar ends today, you will automatically be redirected to the evaluation. Upon completion of this evaluation, you will receive your CME certificate immediately. Even if you are not seeking CME, we encourage you to complete an evaluation and let us know how we did today and what you gained from your participation. Here's our financial disclosure grid. All disclosures have been mitigated. And with that, I will pass it off to Dr. Keenan.
Close. I'm unmuted. All right, here we go. Good afternoon, everyone. So excited to be here to talk about this very important topic that affects not only us, but the community that we serve. We have an awesome group of young ladies here today in terms of to give some good information and the idea that you're not in this alone, that we're all fighting a good fight and that we have to work together to get some change going. Next slide. Again, my name is Dr. Keenan, and I am an assistant professor at the University of Illinois at Chicago. Next slide. And our learning objectives for this afternoon, upon completion of this webinar, participants will be able to identify key community organizations and resources that support resilience in children, especially those impacted by ACEs. Recognize the value of partnerships between healthcare providers and community organizations to promote trauma-informed resilience, building care for children, and to also summarize practical strategies for how to collaborate with community partners and organizations to address ACEs in pediatric populations and resilience building in pediatric care. Next slide. All right, adverse childhood experiences, that is why we're here. And we know it's important because early childhood experiences set the trajectory for a child's life from the very beginning. It affects the way genes work, the way our brains form and function, our resilience to toxic stress, our cognitive and social emotional development, as well as our health and well-being into adulthood. This is the third series of this workshop or of this webinar, and I really hope that you were able to join us when we first talked about what adverse childhood experiences are, and then also what does it mean to build a trauma-informed workplace. Next slide. We're going to talk about a couple of community partners, but I wanted to highlight one that is near and dear to my heart. Reach Out and Read is an antidote to adverse childhood experiences. Grounded in research and policy statements from the American Academy of Pediatrics, Reach Out and Read promotes resilience by integrating literacy into pediatric care and fosters strong parent-child relationships, language development, and emotional well-being. Next slide. The Reach Out and Read model is at the doctor's office, at routine health checkups from infancy to 5 years old. Reach Out and Read trained doctors and nurses and nurse practitioners talk with patients about the benefits of reading aloud and engaging with their young children. They show them, by example, how to look at books and talk about the stories with their infants, toddlers, and preschoolers. They encourage them to cuddle up and read together at home and build routines around books, and gives the child a new book to take home and keep. During the exam, providers also use the book for developmental surveillance, observing how the child and caregiver interact with the book and each other. Next. Based in science and based in research has found that parents who use Reach Out and Read are 2.5 times more likely to read to their children, are 2.5 more times likely to report enjoying reading together. that children's language ability improves with increased exposure to reach out and read. Children's language development is improved by 3 to 6 months. And Reach Out and Read is the only national early literacy organization endorsed by the American Academy of Pediatrics. Next slide. And this is important because we know we still have work to do. On this slide, you will see key indicators for positive early learning experiences. We're doing pretty good on most stuff in terms of, in the black is Illinois, the orange is the national average. So for parent reads to baby every day, as well as percentage of income eligible infants and toddlers with early head start, we are above the curve. I don't know if we're all tone deaf or really just don't like singing. Apparently, we need to get our vocals a little bit better. We do fall behind, and I'll include myself. I absolutely did not sing to my child because I sound like a cat, but that's neither here nor there. But apparently, we do need to sing to our kids a little bit more. But again, there's importance in books, there's importance in reading, it's importance in terms of those relationships that we're building. So there's still work to do. Next slide. Reach Out and Read is a practical strategy to support the resiliency in children. And if you don't already have a connection to a Reach Out and Read site in your state, please reach out. We're going to send out some information at the end of this presentation so that you can connect it to that organization. We are a national program. Next slide. And we have 4 exceptional, extraordinary, highly motivated, highly energetic panelists today, but we recognize that they may not be right next door. They may not be your neighbor. I wanted to highlight the University of Illinois Cooperative Extension. They do provide service throughout the state, and we do have a very large state, and we know that there's a lot of work to be done throughout the state. We have community, economy, health, partnerships, environment, food and agriculture, technology and discovery, as well as workforce excellence. And they provide both education as well as opportunities for partnership at either no cost or low cost. So please make sure to use this valuable tool in terms of getting help to the kids that you're working with. Next slide. All right, so with that, we have the introduction of our panelists. We'll go one by one. I'll let them introduce themselves by name, tell about their organization, and a little bit about what they do every day. And I'll start with Ms. Burns. Ms. Behrens.
Thank you, Dr. Keenan, and a pleasure to see you again. We had the opportunity to meet at an ICAP conference a couple of years ago. My name is Annie Behrens, and I work for Metropolitan Family Services DuPage. And in that role, I lead an organization called the Wheaton-Warrenville Early Childhood Collaborative. There are 9 early childhood collaboratives in DuPage County, which I'll talk about in a little bit. Another thing to know about my background is that I'm also an adjunct faculty member at College of DuPage. And I've been working in higher education for 19 years, teaching early childhood and child development courses. So to answer the question about how my work is with interacting with individuals who have ACEs, I would say that most of us probably are interacting with individuals who have experienced ACEs because 64% of the adult population has at least one ACE. So all of us are probably doing work with individuals. But specifically, the programs that we have at Metropolitan Family Services DuPage, including home visiting and early childhood programming, provide really comprehensive and wraparound services for families. There is an income eligibility requirement, but very often the families that we are serving have experienced some form of trauma. So that is specifically how my work interacts with that.
Thank you so much. And if you have never gone on Metropolitan Family Services website, they have a host of information as well as good classes. Specifically, they have a group that works with the elderly who are taking care of their kids. So like the grandparents that I use a lot in terms of I have a lot of that grandparents taking care of their kids in terms of what does that look like as they're getting older because there's not a parent there. And they also have a young fathers program that I adore as well. So just a lot of good information. If you haven't checked them out, check out the Orange People, also known as Metropolitan Family Services. They're great organization. All right, next on my to-do list, as I have, dun, 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 you all are nervous. I'll do with Gloria Barrera.
Thank
Please.
you. Thank you. And I also know the orange people, like you said. So my work does cross with Metropolitan Family Services, specifically with their behavioral health when we're doing referrals. So I am a certified school nurse and public health nurse with a deep commitment to health equity and trauma informed care. I serve as a board member of the Illinois Association of School Nurses, so that's IASN. It's an organization dedicated to supporting school nurses through advocacy, education, and leadership development to really advance student health and academic progress. In my role as a school nurse, serving a diverse high school population, I work daily with students impacted by the ACEs. I assess not only their physical needs, but also their emotional and social factors that may be affecting their learning and their development. And it really is easier for any student to raise their hand and say, I need to go to the nurse, rather than saying, I need to go speak to a social worker, I need to go speak to my counselor. So that's where the initial visits are usually had. It's here in my office. So really, by fostering that trusting relationship and coordinating with multidisciplinary teams, that's where we can implement the trauma sensitive practices. And I really do help create that supportive environment where students can begin to heal, thrive, and hopefully succeed. As a collaborator with the Illinois chapter of the American Academy of Pediatrics, I've contributed to their statewide health equity efforts through multiple initiatives. I think most recently through the school immunization toolkit. So I'm really happy to be here and to be talking about this.
Thank you so much. And again, a lot of times I think it's front lines and the first person that I can connect with, especially when a lot of the things that are going on are at school. The kids are at school for the majority of their day, the majority of their time. So a very good linkage to talk about. And as we go through this, if you all have questions for the panelists, please make sure to put them in the chat. And with that, we will go to Miss Weil.
Hi, everybody. My name is Eva Weil. I am a children's librarian with the Chicago Public Library System. Specifically, I work on our administrative team for children's services and family engagement. So we do a lot of the back-end programmatic support as well as professional development that supports all 81 of our branches throughout the city of Chicago. We do a lot of training and staff development that focuses on the library as a third space. We know that we see a lot of people, and the library is unique in having relatively low barriers for entry. So we know that in our course of the day, most of our librarians and library workers are experiencing people who have at some point experienced ACEs. So we've been very purposeful about infusing that knowledge into some of our trainings. We've done some partnerships with the YMCA and some specialists here that really focus both on how to establish a welcoming environment that is non-judgmental, that is rich with resources, and that encourages community development and connections outside of its walls as well, has been really, really useful for us. It also helps us connect with some organizations and partnerships that we were not able to previously. So whether that's getting into some of the prisons and jails within Cook County to provide services to families that are experiencing incarceration, or it's simply making sure that our language on some of our worksheets and summer programming materials are inclusive. We know that we experience and encounter this every day, and being able to inform all of our staff workers, not just for children's too, but through every department of the library, has really tied into our mission as well. And I'm very excited to chat more about it today.
Awesome. Awesome, awesome, awesome. And last but not least is Dr. Raga Petruning. And introduce yourself and then tell us about your work.
Hi, everyone. I am Dr. Rega Petrini. I am a general pediatrician at Lurie Children's Uptown. Also happen to be the medical director there, and very involved in Reach Out and Read, and nutrition and mental health advocacy. I think it goes without say. So we are a complex care clinic who see 90% of people on Medicaid, and I think 95% of our patients are ethnically minoritized. So we see so many patients, and I am so privileged and honored to be a pediatrician for these children. And so I am directly seeing these children, especially if they're newborns. I see them almost 20 times in the first 2 years of their life. And because I'm the medical director, we've actually implemented universal ACEs screening, and we give it to everyone regardless of their background, their insurance, things like that. And I think that's really great because we should not have any biases when we're thinking about ACEs. Anybody can be affected by it. And when we give a screener, if someone doesn't have rapport with you yet, it's easier to say it on a questionnaire that I have these needs. And because I do then develop a rapport with these families, even if they don't feel comfortable, even if I verbally ask, a lot of times these families are able to tell me whatever needs they might have. And so there is not a day, I'm not even exaggerating, there is not a day that I think in my clinic that I don't address an ACEs for at least one or two patients in my clinic. Sometimes it's all of my clinics, and it's a variety of things. And I know we're going to delve into it sooner. And I think it actually really opens my eyes to the experience of everybody and how can we really shape our society to support these people so that we can work cohesively. The other thing that I do is I actually teach a nutrition curriculum local public school, and I see children when they're healthy in their learning environment. And one of the reasons I bring this up is because I get to work with teachers and see all, when they have 30 kids in the classroom, the stressors they are going. And I believe that the medical facilities, whether it's a physician or a social worker, should create more liaisons to again build rapport with these people so that they know they can reach out to us when they are struggling, because we may have more purview on the resources that are currently happening, given that there's such a large turnover on what is available and there's always new things popping up, and there's so much noise, and it can be very overwhelming for people if you just give them a list. And so that's why I think I am poised in a unique position that I have resources in my clinic and my social worker, my nurses and case management that we can work together to make it easier to help families on a daily basis.
Thank you so much, everybody. And with that, we'll get to the questions. So the first question is for Ms. Barrera, as well as Dr. Raghu Petruni. Who is the target audience for the resources your organization provides? Do you focus resources on just the child, or do you have family resources as well?
I can go first. So, as a school nurse and public health advocate, the resources I help develop and promote are intended for both students and their families. So really, it's the community. So it's a population health focus. Because we know that a child's health doesn't exist in a vacuum in the school setting. Our primary focus is the child, though. So supporting their physical, emotional, and social well-being, so they're ready, to learn. That means providing the direct care that we do here in my office. That also means providing education and preventative screenings like just health promotion and immunization tracking, and also chronic condition management. But we do recognize that a child's well-being is deeply influenced by their family and community involvement, and community environment. So that's why many of the resources that we have in schools, and that's across the state, they're really geared towards parents, caregivers, and school staff, and it's specific to wherever that school nurse is practicing. So it can include trauma-informed practices, mental health supports, like we just heard, having a toolbox, a list, but then also knowing how to navigate those systems, like Medicaid or local health departments, so that it's not just here's a huge list and now you're on your own. So we really make it a priority to partner with community organizations to provide those wraparound supports, like food insecurity, perhaps housing referrals if needed, counseling services through places like Metropolitan Family Services. So having that comprehensive approach really ensures that we're not just treating symptoms at school, but we're working upstream to support long-term resilience and health equity for the whole family.
Thank you.
So I would echo what Ms. Barrera had said. So what we do in our clinic is we have a universal ACEs screener, and it really looks at housing insecurity, food insecurity, stress levels of the parent. It looks at financial security, education, and their literacy level. And we give this to every child for every single child check. Obviously, a parent can decide not to say it, and then our medical assistant actually inputs it directly into our EMR. So if something is positive, we can see it, and we can see the change actually from the last visit, as well as, so if something's positive, like a resource will go automatically into the patient information that's given to the patient. So as you can see from the things that I noted, most of it is really addressing the family or the parents, because a child may not really recognize they have food insecurity or housing insecurity or things like that. And so we kind of gear it to the parent in the questionnaire, because when we conduct the well child check, we are asking about mental health and diet and school and other things that might be addressing the child. And so this way we're really tackling both. And the way that we have it is we are verbally asking questions. So if somebody did not hear that questionnaire, then I notice, oh, they're, not gaining weight. Maybe it's because they don't have formula. Then I can assess, okay, maybe we need to get them WIC. Maybe we have a formula pantry at our clinic. Maybe they're spending a lot of money on diapers. We're able to give them diapers. So that's one avenue. But also with the digital components that we have, we can have access to things outside of what we have in our clinic that can easily be found. And I have been working with organizations to really vet all of those sites so we really know what they are. So I would say, again, it's both, but it's important to really ask the parents, because children may be really shielded from some of the ACEs that they have because of excellent parenting. And so it's our job to support the family as much as we can.
Awesome. You saw me taking notes. I was like, oh, it could go automated. Good information, my dear. All right, the next question is for Ms. Barron. Ms. Barron, what do you see as practical strategies for pediatricians, pediatric healthcare providers, family medicine doctors, or any clinician for collaborating with community partners?
Yeah, so the best advice that I have is to join your local early childhood community collaborative if that is something that is available to you. Like I said, in DuPage County, where I live and work, we do have 9 early childhood collaborations, including a county-wide collaboration. And so by connecting with that group, even if you just send a representative from your office, right? Like I know doctors are incredibly busy, but if there's just someone from your staff who could attend, you instantly tap into all kinds of community resources and connections instantaneously. And if you don't know where to go for a resource, someone within that collaboration will know. If you do live in an area in the state where you don't have access to a community collaboration, I highly recommend connecting. Even if you do live in an area with a lot of collaborations, I do recommend connecting with your local regional chapter of Birth to Five Illinois. That is a statewide advocacy organization, of which I serve on the Action Council for Region 19. DuPage is in Region 19 for Birth to Five Illinois. And that too is an instant connection to resources, providers, information. And so those are the two suggestions that I have.
Again, I'm taking notes. For those of you all who do not have a pen, we will send out all these resources at the conclusion of this webinar, so don't fret if we don't get the information, as well as Olivia is putting information in the chat. And then also, if you all have community partners that you all have worked with that are very important or have done a lot of great work, please feel free to put in the chat as well, so that we all can kind of learn and work together in terms of targeting adverse childhood experiences. All right, the next question is again for Ms. Burns as well as for Ms. Barrera. How does your organization partner with healthcare providers? What is the best way to engage a partnership or begin a new one?
I can go first. So as a school nurse, I really see myself, and I think my fellow school nurses would agree, as that vital bridge between the education system and the healthcare system. So our organization, whether it's a school district, a public health department, or a collective like the Illinois Association of School Nurses, partners with healthcare providers in several meaningful ways to really ensure that our students receive comprehensive and that continuous care. So, for example, me as a school nurse in a high school, I partner with healthcare providers through care coordination for chronic conditions such as asthma, diabetes, seizure disorders, ensuring that our school health plans align with the provider's medical orders. And then through referral systems, so that's for students who may not have regular access to healthcare, especially in our underserved communities. And this includes behavioral health, dental care, and vision services, just to name a few. And then collaboration through health screenings and immunization clinics. So that's often co-hosted with providers or the local health department. Public health initiatives like vaccine education and communicable disease surveillance is also done through through a school nursing lens, and then crisis response and that follow-up care. So especially for students impacted by ACEs or them having acute mental health care needs, for example, through a threat assessment for suicidal ideations, that's really where we partner with outside providers. The best way to begin a new partnership with a school nurse is to start with a conversation grounded in shared goals, being student well-being, health equity, and access to care. So we really do value providers who are open to that communication, and we recognize the unique access that we have to families, and we really are willing to collaborate on care plans and follow-ups. I think often it's just having a simple outreach email or call from a provider expressing interest in supporting school health. It really can spark, those additional conversations and that powerful partnership. We also welcome involvement through community coalitions, school wellness teams, and health advisory boards where providers can lend their expertise and help shape systems level impact in the school setting.
So similar to what Gloria shared, our collaboration is connected to healthcare providers by having the DuPage County Health Department as core partners. We connect with them not just around health services, but also dental services. They have a mobile vehicle called the Smile Squad that has 2 complete dental offices on wheels that is mobile and available to go out into the community. And so for the past 2 years, we actually had something called the DuPage Community Health Fair, which a colleague and I started a couple of years ago in the interest of creating a one-stop shop where a family, particularly families for whom transportation is a barrier, could come and leave with every single thing that they needed to successfully begin kindergarten. So that included both the physical exam, the dental exam, and then our second year, we were able to provide scheduled vaccines as well. And so that now has become a little bit of a model for the county. We have other community partners who are interested in replicating this event that we have done for the past couple of years. And so I just wanted to share that because it was particularly successful and something that we could share with other community partners should they be interested in doing something similar.
Great work being done with both organizations. The next question will be to Ava. Can you share a recent success story about working with those impacted by adverse childhood experiences?
Absolutely. So I think we have a couple of, well, we have two sort of prongs of successes that we're able to have as an administrative team on the library. First of all, we're able to do some specialized and targeted programming to populations that are unique. One of those has been a partnership with the Cook County Department of Corrections, where we were actually invited in to initially just provide some basic library services like library card sign up, a few book giveaways, coloring sheets, a few small activities in the visitation area of Cook County Department of Corrections, so that when family members were there waiting to visit their loved one who is incarcerated, there was a more welcoming environment, a little less hostile and a little less institutional, a little warmer. It got us the ability to really connect with people inside of the Department of Corrections who had a strong draw to strengthen these supports for family members. We didn't really know that that effort was going on there. And through this partnership, we were able to grow that. So we've developed from offering tabling services to families as they are waiting to visit their loved ones to we were able to do a few contact visit nights where we could bring in hands-on activities, books, giveaways, and those were actually provided to family members and their incarcerated loved ones who were qualifying in a low barrier entry area. So there were fewer uniformed guards, basically everything trying to create a more familial environment and a less institutional one. And that's even been able to grow outside of our youth services. So I know that from that, we're growing a adult book club that'll be in the women's population. So that's just, it's been a great success to be able to see what other partners and organizations that we may not have perhaps suspected were really passionate about this kind of work and about ameliorating some of these harder circumstances. And I think another angle of our success too has really just been thinking about how trauma and how adverse childhood events as a whole intersect with library services. We know that especially during the pandemic and since then, libraries have become kind of a landing zone for all of community. We've started to fill many needs in a more explicit way that were tied to things with public health. We also see a lot of people who may not have other resources or spaces to go to. Supporting our staff and understanding how their services are beneficial and are in fact healing for some of that trauma that our patrons and our community members has gone through. I think that's been really successful, especially as we are a big system and we look at things like, okay, how do we handle things like incident reports and number of behavioral issues that come up, especially in our teens and tweens who are at the libraries after school. Well, part of that has been kind of reframing, well, why might these incidents be coming up? Are they hungry? Did they not get enough to eat at school today? Do they, have other needs that are not being met? And we're able to then think of creative ways to find funding, to maybe give some snacks to these branches. So I think just broadening our mindset on who experiences trauma and struggles and how we can position ourselves to meet their needs comes naturally to library workers and has been really empowering when we can frame it that way as well.
Awesome, thank you. And Dr. Petrini, I'm going to ask you that same question.
Yeah, again, I'm so privileged. This is exactly why I'm a pediatrician, why I stay in academics, and why I learn. So I have so many patients, and I could keep you here all day. See, I'm getting tearing up, but when I'm thinking about them, but my first one was a family who actually came to the U.S. on a lottery because their child had a significant medical need. And then she was actually 20 weeks pregnant. And the mom was getting abused by the father because the father felt that the patient was too medically complex and needed to live in a residential facility. So a facility where they would take care of all of his medical needs. But the mother wasn't ready to do that yet. So she came to me. Now she was a single parent and she didn't know what to do. And so um, I evaluated the child after a long time talking with the specialists, extra meetings. We did determine this child needs to have a breathing tube, a tracheostomy, and that he would benefit from being in a residential facility and really help mom feel okay with that. Simultaneously, she had another child, and then she gave birth to the child she was pregnant with. And because mom had never worked before, did not know the language, did not know the country, she was financially strapped and had every, housing, food, financial insecurity. So with the help of social work, we were able to secure mother a job, and then she was able to put those children in daycare. And because of that, she was able to have better housing. So the children who had eczema and the baby was actually not growing, they were thriving. And now 5 years later, mother has a job, both kids are in school, and they're really thriving. So I mean, if we can partner and we have access to these resources, we can really make a difference in these children. And the other one I want to say is why we should do universal screening is there was a patient and the child was actually diagnosed with a severe progressive illness, Duchenne's muscular dystrophy. Some of you may know of it. And there's a treatment. And if they get into neurology quickly, they can start the treatment early, but that is imperative. But the parents kept missing the neurology appointment. And we thought maybe they refused diagnosis, they didn't know the severity, things like that. But then one day when I went with the resident, I said, sometimes we don't make appointments because we can't get to the appointment, or you have a work schedule and you can't get it. And the mom broke down crying and said, yeah, I don't have a car. I live far away. I cannot make these appointments. And then we were able to use, with a social worker's help, the medically covered transportation. And now, a year later, that child is in neurology and getting the therapy and is not having any of the negative effects of Duchenne's because we were able to fix that problem. And it was an easy problem, but had we not asked that question, this child may have started to negatively be impacted by this diagnosis when there actually was a treatment. So I cannot stress enough that it may add time to your clinic visit. It may seem like, how can I do this among all the other things? But sometimes addressing these needs are more important than asking something else. And that's okay, I think, to put aside those other needs to really work with the parents to figure out what's their biggest need to support their family.
And one thing I heard in your answer was partnership. So the question that I have for you is, what advice would you give someone looking to find resources for children or families impacted by adverse childhood experiences?
Yeah, so what I would say is, if you're obviously I'm a healthcare professional, so I can speak. So what I would say is, implement universal screening at your clinics, because and give it to everyone. We, long before this automated system, we worked and we were just giving paper to every single person. But now we have this automated system and we're able to easily track. And even if you forget in your visit, you can easily call the parent and say, hey, I noticed you had food insecurity. The other thing is you can do, like the Greater Food Depository, wants to help. And so we have a food pantry through, so you can absolutely look at what is close to you or if you can start a food pantry at your clinic. The other easy things and low hanging fruit are a diaper. So we actually give diapers to children until size 5, and we have like a diaper screener, and the residents actually sponsored this project. So a lot of the commercial brands, or if you work through a hospital system, do have diapers that are lower cost for them. And so you can partner with them to provide something that is very expensive to the family, but very easy for you to do. And the last thing that we do is we actually, when someone is positive in our screener, we have partnered, we used to use NowPow, which is now merged to Unite Us. And so Unite Us is a wonderful resource that you can, it will posit, like if you have food insecurity, it will add it to the patient information. But also, let's say somebody needs swimming because they need to learn how to swim because of X, Y, and Z. Or I had an autistic patient who really benefited from low cost classes and it really helped their behavior. And so you can search. Now you might say, my organization, I'm a small clinic, I can't afford these things. There are public websites for Unite Us. So there's a public website that you can use, and you just put in whatever resource you need and the patient's zip code, and it will, based on where they live, it will give you the different resources and you can provide it for the patient. And the last thing I would do, it doesn't so much apply to me because my patients they drive like an hour to see me. But if you have a clinic that you're really serving that neighborhood, I would just walk around your clinic and see what's there. You know, there's a local public library 3 blocks from me. There, I have a YMCA and a Salvation Army. So if you know what's around, then you can often provide those for the patients. And I would create like a dot phrase or an easel sheet that you can just grab it so it's easily accessible in that busy visit to give them that resource. So those are all the ways I would say that I would partner and, you know, tackle it. And remember, we can't do everything in a time visit, but if you continue to see these patients and build that rapport, they will come back to you. Like the diaper thing, I truly believe that some people just come for their well child check to get the diapers. But then for me, I'm able to assess their growth, development, and get their vaccines. So to be honest, I'm happy that it is helping everyone in that situation.
And then I'd like just to add 2 more things in terms of the way that I do in terms of my practice. Think about organizations they're already working with. WIC is more than just getting milk and getting food. They offer a lot of different resources and programming and activities. So connecting with your local WIC. Also just talking to patients. My favorite downtime while doing the exam is, what are you doing this summer? What are you doing after school? I am the nosiest person that you'll ever find. But again, they know their neighborhood. They know which ones to go to. They know which ones to avoid. And then that's how you kind of get to know your community. You're living it through your patients. So I would say, don't be afraid to ask questions because yes, they're there to teach you. You're there to teach them, but they have so much that they can teach you as well. Okay. All right, last question, then we're going to open it up to questions from the audience. What is something that your organization offers that might surprise other people? And I'll start with Ms. Barron.
Thank you. So one of the things that might surprise people to learn is that Metropolitan Family Services page is about
Annie, there's your mic is like very quiet now suddenly.
this. Can you hear me?
It sounds like you're underwater, honestly.
Oh, sorry. I don't know. Let me maybe come back to me.
Okay.
All right, I'll start with you, Ms. Barrera.
Thank you. So one thing that might surprise people about school nurses is that We really are the public health leaders embedded in a school setting, right? In this education system. And something that we offer that might surprise people is our role in the crisis response and trauma informed care. We're often the first to recognize the signs of any kind of stress, abuse, neglect, and we create those safety plans, coordinate care, and advocate for services really behind the scenes. So this is all the while building trust with students who may not feel safe anywhere else. Another unexpected thing or role would be policy advocacy. So through the organization that I mentioned, the Illinois Association of School Nurses, we are actively involved in shaping state policies on issues like mental health access and vaccine equity and ensuring that students have access to a school nurse. So people really are often surprised to learn the encompassing role that school nurses have, and partnering with local coalitions. I think that's been a common theme to address the social determinants of health. For example, just last week, I partnered with Advocate Health to have a stress prevention pop up here at my high school. It was a huge success, and we now have sort of a roadmap of what other stress prevention pop ups we can have next year and beyond. And really, tracking community health trends would be another surprising thing, and supporting family engagement. And that's through helping caregivers navigate those complex healthcare systems that we kind of learned about today. In short, school nurses really is that connective tissue between health, education, and community systems. And it's offering far more than meets the eye. So I really hope that by joining today, that somebody has learned a little bit more about the school nurse role, and is ready to ask, if your child doesn't have access to a school nurse, why not?
You were almost, I was like, yep, you almost got me preaching to the choir for that one. Absolutely. I'll say from my perspective, something that would be surprising. Again, I'm a pediatrician, a general pediatrician, but I put out a newsletter at least once a quarter, and a lot of times it's topical. For the one that we did in August, it was summer safety, and then it highlighted programs in terms of both jobs for the teenagers as well as summer programs for the smaller kids, just because, again, I would think with the kids being at home from school, they have access to a lot more adverse childhood experiences because they're in those communities, or some of those communities, they're in those homes in terms of where there might be things going on. So my goal is in terms of how to protect our kids. During the summer, we'll do a back to school edition highlighting, like what is an IEP, what is a 504, again, using those resiliency resources and getting them out to patients. So again, it may not be that, we forget to just doing a one-time newsletter so it could go out to everybody who needs it, would be one helpful thing as well. So with Canva, I am also a creative something, whatever you would like to call me. But that's something you would be surprised that I do as a doctor. All right, I will open the floor to questions. And if you don't have any, it just means they get to come from my beautiful little head. All
Hi,
right.
can I just answer one of the questions that was asked about development in their pediatrician visit?
Yes.
Yeah, so I answered this, but
Can you restate the question? Go
yeah,
ahead.
the question was how can we advocate parents for their children, when this person was saying that they go to the doctor's visit, they're only concerned about the current illness and vaccines and not about their child development. How, if the parent doesn't have enough knowledge, what can we do? And so what I would say to that is there are so many things to address in a well child check, from diet to elimination to school issues, but part of this well child check is to address development. And so absolutely your pediatrician should be doing that. However, let's say, somebody didn't have food or housing, or there was, a mental health concern, or your child has an asthma attack, that might be more serious than the development portion at that visit. And so you may have to come back so that you get the time that you need to really assess development. And it's really important to make those well-child checks. But if your pediatrician isn't doing that, then you should express that concern, and then make another appointment. So that is part of it. But the CDC actually has a wonderful website about milestones, and there is videos, and it's called CDC milestones. And so that's another thing you can do to say, hey, my 9-month-old isn't doing these things, which I looked at the CDC. So I really love that, in addition to obviously early intervention and things like that. But that's what I would say. And then somebody also said, what are the process when someone screens positive for food insecurity? So there are several different things. If you don't have a food pantry, you don't have food. A lot of clinics don't have that. But there are several options through the public school, and then through the websites I was saying, like the Unite Us. You can put in a person's zip code and then look at the food pantries and go with the family and say, hey, is this close to you? Can you go to these things and track? Because there are several different organizations like the Greater Chicago Food Depository that are trying to combat food insecurity. So there are a lot of local organizations near that family. And so if you have a list of a few, that will be easy access for you to address that.
Thank you so much. And then sometimes I think some people are afraid to seek a second opinion. If you've asked that physician or medical provider 2 or 3 times and you're not getting what you need, please find someone else. That's just my 2 cents. It's okay to get a second opinion. And then I would also say the public library has a lot of resources as well. At least in Chicago, they have Child Find, which is by CPS, or the Chicago Public School System, and they do developmental screenings. You can look online for that. It's going to be during the school year. I think they do take a break during the summer, but they do developmental screenings from the ages of 0 to 5, and will help them either get early intervention or an IEP.
And
All
just
right.
to add on to that real quickly, I think a few other angles that the public library can really help support some of that is we have a lot of emphasis on the birth to 5-week child range, and there's been a lot of really good shifts in what we're offering, not just for kids themselves, but for parents. So just to give an example, we have a new program called Get Ready for Baby that is designed for expectant parents, and that kind of walks you through what some of the developmental milestones that you might expect are. That is basically all about empowering them and making those social connections. We're also thinking about how we can support parents who speak languages other than English primarily. But that also, the library can connect you to so many resources, and we have so many things within our walls as it is. We do coat giveaways in the winter. We do, I believe all of our branches now have Narcan available for free in them. And there's really very few situations in which we will say we don't know where to find that. And I think especially for immediate needs that people may not think of the library for, we can help put you in touch with food pantries, with shelters, with social workers. And that is something that we explicitly train our staff on how to do and how to recognize.
And then I'm gonna, Annie is still having issues with her mic, so I am going to answer the question for her. And the question was, what is something that your organization offers that people might be surprised about? And her answer is, you might be surprised to know that the Metropolitan Family Services DuPage is about to begin offering clinical mental health services for our clients. And once that is established, we hope to offer 0 to 5 mental health services for the community. This includes play-based therapy and supports both parents and families. And I think that's absolutely spectacular, because sometimes when we think of mental health, we think of our teens or our pre-adolescents, but there is mental health concerns in terms of our young ones too. So that's absolutely awesome. All right, we have 6 minutes left. Any other questions from the audience? And if not, in closing, why don't each person give a shout out in terms of something you all are doing in terms of summer programming with your organization. We're going into the summer. The kids are going to be busy or not busy. what are some things that you can offer them when this weather comes that's not here yet? When it comes, what can you offer? Go for it.
Well, the library has our summer program that runs from June 21st through August 8th, but it is also ongoing all summer. The emphasis is for kids, but it is open to everyone. There's reading challenges and learning challenges, as well as all of our branches are having events and programs. Our theme this year for summer is nature, and it's growing green, growing minds. And we're going to have a lot of really exciting programs through all of our community areas within Chicago. That'll include animal performers, stewardship, all sorts of very exciting things. And we're also just happy to connect with other groups and organizations who may want to do a little bit more during the summer. We know that that's sort of a time when we can step in when there's a more out of school time. But yeah, we're really excited to have a nature focus this summer that's going to encourage kids to build that love of the natural world around them.
And I have from Ms. Behrens from Metropolitan Family Services. They are offering 3 different developmental screening events, one in June, July, and August at the Warrenville Library. And we'll put that information both in the chat as well as in that follow-up email so everybody can get that. Ms. Barrera, is there anything you would like to add? Get your school physical done?
Yes, yes, please. It's never too early. I think I am really interested in reaching out to Ms. Burns and seeing how that community health fair can maybe be expanded to the district here at the district level, and then seeing how maybe feeder schools can have access to the health fair as well. So I will be reaching out to you, Annie. Thank you.
Dr. Ragu, Petrini, any last thoughts?
No, yeah, start early on your physicals. We love to see you. No question is too small. So please reach out for us. Feel, you know, being as inviting as possible is important. And I can't stress the universal screen enough because we don't want to have any biases when it comes to assessing.
All right, and with that, this is the conclusion of our webinar. And I bet Olivia was about to say that before I did. One more big
You're
shout
totally
out.
fine. Go ahead,
One more
sorry.
big shout out to Reach Out and Read. Again, an awesome organization, as well as Doc Assist, who's another one of our partners. So if you haven't heard about them, they're doing great things. We'll send you some information as well. And with that, I'll turn it back over to Olivia. Thank you, guys.
I'm just going to pop in real quick to say thank you so much to our moderator, Dr. Keenan, as well as all of our wonderful panelists for sharing their expertise with us today. I hope that you have all taken something with you that you can add to your toolkit and tool belt to be prepared to help address those ACEs as they come up. So thank you all so much for sharing space with us today. When this webinar ends, you will be automatically redirected to the evaluation. Please be sure to fill out that evaluation for those continuing education credits, and we will follow up with the slides and recordings soon, as well as all the resources that were shared in the chat and in our speeches today. So thank you so much. I appreciate you. Enjoy the rest of your day. Get some sunshine, hopefully.
Bye, guys.